Hello, everyone. I was about to say good morning, but now I realize it's noon on the East Coast. So good morning to those of you who are not on the East Coast, and good noon to those of you who are. This is Shelley Fold-Nasso with the National Coalition for Cancer Survivorship, and I'm here with Kelsey Napodi. We are excited to share with you a little bit more of what we're thinking about in this Elevating Survivorship initiative that we're launching. I know that you all received information from Kelsey about it, and some of you have been in touch with questions. We've gotten one nomination for the Ambassador program already. So we're excited to just tell you a little bit more about it, answer any questions you have, and we will post this. We heard from a number of folks who couldn't join us today but are interested, and so we will post the webinar for people to go back and listen to, and we'll try to answer any questions you have either during this webinar or after, because we still have a couple more weeks before the nomination deadline for the Ambassador program. So we want to start just by talking a little bit about what we're trying to accomplish with this program, and let me figure out how to advance the slides. This is not my area of expertise. There we go. So we launched Elevating Survivorship as an advocate-led initiative to improve survivorship care in the United States. And so we started with the survey that many of you participated in, and we were using that to help just better describe some of the gaps in survivorship care that we see from an advocate level, and then to the next step being working with you all as advocates to help improve survivorship care at the local level, and also to educate audiences about the need for post-treatment survivorship care. We're looking forward to sharing the survey with you later this spring. I think you will be interested in the results, but not totally surprised. I feel like it confirmed what we knew, but gives us really good data points to be able to share about where we see the gaps in survivorship care. So just to talk a little bit more about the survey, we were really pleased to have more than 1,300 responses, and we want to thank all of you who helped share it. More than half of those came from NCCS constituents and constituents sharing the links, but we also partnered with a number of other organizations who helped us promote the survey, because we wanted to make sure we got a wide range of different types of cancer, and we were really, really pleased with, first of all, with the number of responses, but also the breadth of different types of perspectives that were represented. We had a lot of different types of cancers, different age ranges, different income levels, different parts of the country, different race and ethnicities. We were pleased to see that. And I'm not going to say we were perfect in every one of those categories in terms of representation, but it was very, we have a very good sample. We were pleased with it. And so we're looking forward to getting the full results, but I will say that one highlight that I took away from it was that cancer survivors who were surveyed felt like their physical side effects are much better addressed and considered than the emotional and really all of the non-physical side effects of their cancer. And I don't think that'll come as a surprise to most of you, but you know, the care that's being delivered is really directed at the physical effects, but cancer survivors still don't feel completely prepared to make that transition after treatment, and to address the other aspects of their life that have been impacted by their cancer experience. So that's just the very high level, and we'll be sharing much more information with you about that in the coming months.
And before we start going through the nitty-gritty, I don't think we mentioned it. If you want to ask a question as Shelley's talking, you can do the chat box, and then we'll open lines. There's not many of us, maybe later. But if you feel like you might forget it, you can just put it in the chat box, and we'll get to it.
So really, our idea behind the program is that there are things that that we as advocates and cancer survivors can do at the local level to improve survivorship care. It's really clear that there's a lot of different models of survivorship care. Some work well, some don't. There's, you know, academic medical centers that have big survivorship programs. There are community practices and community hospitals that may have smaller programs for survivorship care or may have limited survivorship care. There's not a one-size-fits-all answer to what's the best survivorship care, and so a lot of it is really looking at what is working well in the community and where the gaps are for survivors in the community and what can be done. Now, we know that you as an advocate and survivor are not going to have the ability to launch a survivorship clinic at your community hospital. Obviously, that's something that would take a lot of work with the practice. But so we're working very closely with Mary McCabe on this project. She's helping us develop the curriculum, and we'll be at our in-person training in April. And one of the things I love that Mary always says is there are always things that can be done at the small things that can have a really big impact for cancer survivors. And so there are things that you can do, even if it's not at the level of creating a survivorship program from scratch, but if you have relationships with your community practice or community hospital, or if you're on a patient family advisory council, or if you have involvement with other community groups or other virtual online groups, there are things that you can do that can make a difference. And so what we want to do with this program with the Elevate Ambassadors is to work really closely with a small group of leaders to help you all develop an idea and implement that in your community, and then have a virtual learning collaborative of the ambassadors who can learn from each other about what's working. So this is really what I want to make clear with this. This is not just a training that you come to and absorb a lot of information and that's all. This is really, and that's where we tried to, in the call for nominations, to describe the time commitment, because what we're looking for people is who have maybe an idea of what you want to do and need some support and help to make it happen, and we want to work with you to do that. And so we're hoping that we'll have out of this some exciting ideas of ways that advocates made a difference in their community with results that actually help cancer survivors. We're going to start with a small group the first year, but we definitely hope that we can continue to raise funds for this program so that we can do this again next year with maybe another group or a larger group. But we're starting with a small group this year to make sure that we do it well, and then learn from what works and what doesn't work before we take it to the next level with another group. So we are looking for folks who have an idea. You don't have to have every detail of that idea sketched out, but to have an idea that you want to pursue. It may be something you've started, but you want to expand it or take it to the next level, or maybe something totally from scratch. We try to also define the idea of what the community is to be broad enough that it doesn't necessarily just mean working with your hospital or your community practice, but if you're involved with community-based organizations or your churches that may have an avenue to reach cancer survivors or survivorship programming in a different kind of setting. We also want to be open to other ideas, like if you have a virtual community of cancer survivors and you have an idea for something you want to do with them. So we will be starting this group. So the applications are due at the end of January, and we will make a decision by, what's the date that we said, Kelsey, the beginning of March or the end of February? We're going to do it as quickly as possible, but
I don't think we gave an exact date.
Right, okay. But then, so the first big thing will be an in-person training in Washington, D.C., April 25th and 26th, and we do have funding for travel scholarships for those, for people to come for the in-person training. And then we anticipate continuing to work with you over the rest of the year through webinars, one-on-one support, virtual learning collaborative to help the ambassadors learn from each other. So that is kind of the high level of the ambassador program. So the application, do you want to talk a little bit about the application, Kelsey?
Yeah, I could start. It's a self-nomination process, and just the high-level criteria is an ambassador must be a patient advocate, age 18 years or older, who's been touched by cancer, must be a member of CPAT. Doesn't mean if you think you have contacts outside of CPAT that you couldn't tell them and they could join and become a part. They don't have to be a part of CPAT for, X amount of time. And then an ambassador must be committed to working at the local level to improve survivorship care. There's a little bit that we say on the website about preferred expertise and composition. Just make sure you take a look at that. Nothing complex. But I guess I didn't go through once we created this to see how long it would take to complete this application. But because we are looking for certain things to be uploaded and retrieved, it's something I would, if you're thinking about it, I would at least start, and you can save it along the way. But it has general contact information, and then it has quite a few open-ended questions where we want to hear from you. Kind of your standard questions that you would think that would be on a form like this, but also demonstrating your ability to foster relationships with relevant stakeholders. I think Shelley talked about, why that's important, because we want to know that you have the ability to get in and have people support you. But I think there's different ways to demonstrate that in a long kind of form answer. And then making sure we want to know the specific needs in your community that you would like to address. And again, reiterating what Shelley said, community is kind of up for you to describe, but because of that, we need to know what those needs are. Your regular resume or CV, a narrative biography, and then a letter of support. This letter of support, hold on, I can't see it, it went away. We recommend it's from an individual and organization in which you've been partnering with on a project, a previous project, or maybe this project that you want to propose and do something else with. The letter should address your ability to serve as an ambassador and demonstrate your commitment of your partner to work with you on this project. If you have questions about that, if you have questions about any of this, whether I think it would be a good fit, certainly can't fill it out for you, but I would be happy to help you present you in the best light possible, because I will most likely be familiar with all of you, or most of you. Do you want to add anything about the process?
No, there's a couple questions that have come up that I think we can answer now.
Okay.
They're specific to the Elevate Ambassador. So one question is, what if we don't have a concrete idea but have the beginnings of one? Is there some room for collective ideation before committing to a particular idea? I think definitely there is. So I think if you share the beginnings of your idea in the nomination or application, I think when we are together in person, we'll really have a chance to share our ideas, and I think there'll be a lot of opportunity for ambassadors and the staff that are there to help each other build on those ideas and then come up with a plan. So I think there's definitely an opportunity for that. There was also a question of the ideas that may have a financial need. Is that up to the applicants? We're hoping, so we're not going to be able to grant money to programs to implement these ideas. So we're hoping that if you're working with, say, your oncologist office, that they would be willing to dedicate some resources to it. It doesn't mean we can't, brainstorm other opportunities for funding, but our funding is really going to be about the technical support to you, but we don't necessarily have the funding to support the programs, the actual programs that are being implemented, but our hope is that working with the community partners, you'll be able to find resources for it.
Kind support at least, or something.
And there was another question of who should we contact to run ideas by. You can definitely, Kelsey can help if you have, want to ask her questions or run ideas by her before you submit your application. Also, please note that we may follow up with you and ask more questions. It's not like you submitted and that's it. We won't have, if we want to talk with you further about it, we may ask if you have time for a phone interview where we can talk further about it before we kind of make selections, so that we can make sure we're getting, the best of ideas that we can, do in the first year. And I anticipate we're going to have a lot of incredible ideas we're not going to be able to, and advocates we're not going to be able to choose in the first year, but I hope that you will continue to be engaged with us and look forward to the opportunity in a future year if we can continue to raise funding for this exciting project, that we can work with another crop of ambassadors in 2020. I know. Hearing Kelly here. So the second piece of this, which is separate, and you can apply or nominate yourself or sign up for both of them, but is a Speakers Bureau. So what we did was we created a Survivorship 101 presentation to really kind of go through the history of survivorship, what are the needs of cancer survivors. We shared, for those of you who attended the symposium last June, that when we had breakouts, there were 2 breakouts, and a big group of you all were in the breakout with Kelsey and me where we were kind of previewing the Survivorship 101 presentation. We have been working on making updates to it and refining it. We worked with some incredible experts on survivorship that helped share slides that they've delivered over the years, including Julia Rowland, who was for many years the director of the Office of Cancer Survivorship at the National Cancer Institute, and she's now an NCCS board member, and Mary McCabe, who I mentioned, who had been the director of survivorship programs at Memorial Sloan Kettering. Susie Lay, who presented at the symposium, one of the NCCS founders and has an oncology nurse and multiple-time cancer survivor, has really done an incredible, she gives an incredible presentation on kind of the history of the survivorship movement. So, and Lori Eisenberg, who's one of our board members, who's also been very engaged in trying to improve survivorship care in her community in San Francisco. So we kind of took a lot of these slides and that people have used in different presentations and updated them and try to create something that you could use to customize for whatever audience you're going to be delivering it for, that has some template slides for you to add your own experience. It's probably more slides than if you have 15 minutes, there's a version you can give. If you have an hour to give a presentation, there's enough slides there to give you content for that. So we're excited about sharing this with you all, and so this is really just if you want to do this, we want you to just sign up with us just so that we know who's interested and that we can. We're going to do a webinar in February to walk you through the presentation and talk about it, and then so we know who's got the presentation in hand and who may be delivering it, because what we really want to do is have you share with us when you've given it how it's worked, what kinds of, if you have ideas for ways we can continue to improve it. And so we kind of know who's out there doing this. So we are not going to be booking speaking engagements for you. We will be, we will leave that to you, because you know where you may have the opportunity to deliver this, and whether it's to a group of survivors or to a group of providers, and there may be ways you want to customize it. We're going to be here as a resource to help you as you do that, but we'll really just leave it to you to take this and share it where you have contacts and where you think that it would be, you have a good audience who would like to hear it. So for this, you really just have to sign up. We did ask for a little bit of information about you just so that we know, and sometimes because we know a lot about you from when you sign up to be a CPAT member, but there are some gaps in what we know, and it helps us to have that information. Anybody, this is not a selection process. Anybody who wants to participate can sign up to participate, and we will share the presentation with you when we do the webinar in February and make it available to you. So if you're interested in applying for the Ambassadors Program, you still should and can sign up for the Speakers Bureau. Also, obviously, the time commitment here is much less. It is really up to you. If you want to do a presentation every month, if you have people who are interested and you can do that, that's great. Or if you if you just have kind of 1 or 2 presentations in mind, that's fine as well.
And I think this could be a good gateway for one, if you don't think you're ready for the Ambassador Program or don't know, this might be a good way to start making relationships as you get into different venues or different audiences to talk to. And as you all know, I don't think you need us to tell you, but things just start to fall into place and you get asked to do more and you get busy really quick. And then if you do apply for the ambassador and it ends up not being your year, it would still be, I think, a really good opportunity to stay engaged with the other side of the program as well as much as you can for those same reasons. But also, you know, if something comes up, I think it's just be in your best interest to stay engaged.
A couple of quick questions. One was, do you have a date for the Speakers Bureau webinar? I don't think we have set that yet, but we will set that in the very near future. And that will definitely be recorded for future use, because we know it's always hard to find a date and time for a webinar that everyone can make. And so luckily the new webinar technology we use makes it pretty easy to record things and save them and have them available later. See.
So you said you covered this, and then the sign up is truly a sign up. This is the criteria that you're looking at, very similar to the ambassadors, a little different. I think Shelley really covered the time commitment, but we are looking for presentations 2 to 4 times a year. I don't think there's anything new on that, but it's, I think it's named, just a couple of questions. It comes into me. Yeah. And that's on where you can find it. So you have it in your inbox. I'm sure we're going to send another notice before the due date. But if you want to go look at the initiative, it's under advocacy and then Elevating Survivorship initiative.
Sarah said the audio is going in and out. It's not?
It's updated there.
There it goes. Okay.
Okay, so hopefully you can see the screenshot that shows where you can get to it on our website. And please do feel free to share this with other advocates you know. Like as Kelsey mentioned, you know, signing up for CPAT is free and easy, and so we're open to, of course, you all who are dedicated CPAT members, you get the first crack at this, but we want to, you know, if this is something that you know somebody who might be interested in and they're not a CPAT member, they can easily sign up and participate.
Did you answer, did you mention that, so it does, the sign up closes, everything closes on the 31st. Did you address Sarah's question?
I think
that was for the webinar.
Yeah.
But for the Survivorship 101, we might, you know, evaluate where we're at with that, where we think capacity is at. But the ambassador is more of a hard deadline, as whatever hard can, yes.
So that's all the slides we have. Do you all have any additional questions? I know we've been answering some questions as we go, but we are here if you have additional questions.
How many?
Lenora, how many individuals?
I assume that's for the ambassador.
Yes, for the ambassadors. You know, we're going to see the applications. We have a target in mind, but we're going to be a little bit flexible as we see. But it's going to be it's going to be 10 or so. It's not going to be a large group, just because we really want to make sure that we can adequately support people that we select to be part of this, and so we want to make sure we do it right in the first year. Go ahead, Kelsey.
For Randy, how much effort do you wish targeting Congress? That's not one of our kind of pillars of things we're thinking about. I'd be interested to see what you would, you know, present that covers Congress and the community. But I can talk to you more about that if that's helpful, Randy.
I would say that's not really a focus.
Yeah.
I mean, I think we're really looking at kind of the delivery of care or support for survivors at the local level. Not to say we're not going to be continuing to work with Congress on separate, and you will be hearing from us on, and we have some high hopes for, some good legislative campaigns this year, but I think this is really more about the care rather than about the policy side of things for this particular program.
I mean, you could also think of it, though, all the work we do through these programs, or all of our programmatic work, supports our policy work. So it could do a full circle, but it would definitely not, I think, be the goal of the initiative.
Right. Okay, Randy, I see your about your relationships. That's wonderful. We will, and frankly, if anybody has relationships with the new members, let us know, because there's a lot of new members of Congress, and we are working to. Lindsay's actually on the Hill today, meeting with folks, and I'm going to a meeting with one of the new members, who's a cancer survivor, this afternoon. So if any relationships you all have or contacts that you would want to share with us, we would really appreciate that.
So the letter of support. I think first, and I can work with you, Liza, with the phone if it helps, if you want to tell me what you have in mind of doing and the type of person that would be good to submit something of support. And the more specific you can be, and maybe that's best if we talk offline, because I can help you. I don't know if I can say more than what I've already said, but somebody who you have a relationship with in the community or the group of individuals you want to target, and that person could either serve as a mentor in a more fluid way with you, serve as somebody you could go back to and bounce ideas off of. Because what's hard is we don't know these communities. And these people should, and know the type of work you want to do. And there's so many different, I often like to think of this as like taking survivorship to the street. There's so many more venues or people than, your former oncologist or care center. I've heard of fantastic work being done by our CPAT members that is literally happening very, very much within the community, sometimes in even small but concentrated sectors where you can see results. So then you find somebody who could support that, which might be easier to do it that way.
But I would just add to that, if you are interested, if your idea is related to something that your community hospital or your community oncology practice will do, the point of the letter of support is that they're interested in working with you on it. So it could be, some of you are on patient family advisory councils at your hospital, and that would be just to show that they're interested in working on, because, I know in Field of Dreams, if you build it, they will come. It doesn't always work that way. So there are things we can do as advocates, but I think if we can't force providers to do things, but if the letter of support shows that if you're wanting to get your oncology practice to do something, that they're sort of at least willing to consider it and work with you on it. That was one purpose of the letter of support, but that doesn't apply to all situations that Kelsey was talking about. So I think we've answered all the questions we've had, and I know that some of you are having problems with audio and some of you are able to hear us. So I'm sorry for the difficulty there, but we will, of course, be available to answer questions by email for those of you who weren't able to get your question or weren't able to hear the questions. Are there any additional questions that we can answer?
It's nice to see so many familiar people.
All right, well, thank you all very much. I think we'll go ahead and wrap it up because we're not seeing new questions and know some of you have had some technical challenges. So we will be available if you have questions. Thank you so much for joining us and for your interest in learning more about this. We're super excited about it. and have fun shoveling snow, Mark. We've got it all down here.
No such thing as fun.
Have a great day, y'all. Thank you very much.